Hello, everyone, and welcome to Accessia Health's Amplify Your Voice, Control Your Care, the first in a hopefully long series of webinars designed to do exactly that, allow you as patients and advocates to amplify your own voice and control your care. We're thrilled to be here today. My name is Gwen Cooper, and I am the CEO of Accessia Health. And we just have a few housekeeping items before we get started. We're happy and extremely pleased that so many of you could join us for what we're sure to be an informative session. But first of all, we have a few ground rules. All lines are muted throughout the duration of the webinar. However, we will welcome you to submit any questions throughout the event through the Q&A section on your screen. If that doesn't work for you, please feel free to put a question in the chat and we will be monitoring both. We'll have time at the end of the presentation to answer all of your questions. If for some reason there's so many of them and we don't have time, we'll be sure to get back to you with answers. And this webinar is being recorded, so you will be able to refer back if need be. Of course, anytime we're doing a webinar, we have disclaimers that we have to read. So bear with me while I read the script to make sure I don't get anything incorrect. Accessia Health webinars, events, and conferences are intended to provide information to the public. The views and opinions expressed by any speakers or other third parties are not necessarily those of Accessia Health. In addition, the presentation of any material or information by a third party regarding any specific opinion, commercial product, process, or service by trade name, trademark, manufacturer, or otherwise does not constitute or imply Accessia Health's endorsement or recommendation of such opinion, process, service, item, or organization. Any such material or information presented by a third party in any format at an Accessia Health event without invitation is for informational purposes only. In other words, enjoy the experience, learn a whole lot, but please remember copyright protections. With that, I would love to introduce our speaker. I have known Elizabeth Johnson since NAMAPA started. She was one of the first people that I met when I heard about this incredible organization called NAMAPA, and I'm sure she's going to tell you a little bit or hopefully a whole lot about it. So we were thrilled when Elizabeth agreed to be the first guest on our Amplify Your Voice, Control Your Care webinar. A little bit about Elizabeth, or Liz as we like to call her. She started her career in allergy and immunology and fell in love with the challenge of specialty medication access. Currently, Liz is the Chief Executive Officer for MedicoCX, a group of independent specialists unified by patient-centered access to biologics in a timely and cost-effective manner, as well as a co-founder and the president of NAMAPA. Elizabeth is a licensed practical nurse with a rich background in patient care, and she holds multiple certifications, including certified professional coder, prior authorization certified specialist, and a board certified patient advocate. These exemplify her knowledge of some of the most integral parts of medication access and the healthcare spectrum. Combining this knowledge with her love of training, Elizabeth has been able to successfully and consistently educate facilities and physician practices on various methods of acquisition for injectable and infused biologics and biosimilar medications. Her efforts have resulted in millions of dollars of unrecognized revenue from medical practices across the U.S., all while maintaining the patient and their access to treatment as the highest priority. When we talked to Elizabeth about the first topic that we would want to focus on our Amplify Your Voice, Control Your Care, we decided that insurance was probably the best place to start because it is so confusing and ever-changing. So with that, I would love to turn it over to Elizabeth, and we hope that you enjoy the webinar. And please remember to throw any questions in the Q&A or the chat. Welcome.
Thanks, Gwen. I appreciate it. And hello, everyone. I am absolutely delighted to be here to talk about this. This is, to me, the foundation, the building blocks of how you can really advocate for yourself, right? I will be the first person to tell you that I am not the world's greatest advocate for myself. I get to the doctor's office, my hands get a little clammy, I forget to ask questions. So I love to share the transparency in that. And I love to be able to talk about how you can take the things that I struggle with, other patients struggle with, and really make the most of it for yourself. So we're going to cover some insurance basics. I know we all know what insurance is in general, but maybe some more finite points that'll help you in conversations. If you're shopping for new insurance this year, depending on what you have going on in your life. So we'll talk a lot about Medicare. We have a rapidly growing Medicare population, and that's the most confusing thing out there, I think. So we'll kind of break that down a little bit. We'll talk about some assistance programs and some things that are out there to help those patients, and then really how to be your own advocate, and then some other resources in case you have any questions. And speaking of questions, there is a Q&A feature in here as well as a chat. So feel free to throw in questions. We want to make sure we get to those at the end, and that way we can have that for later too. So what allows me to kind of be here besides my deep love of Accessia Health? Well, I've been in the healthcare space for about 12 years now. I went to nursing school thinking I was going to be a bedside nurse forever. Someone handed me a book with a bunch of patients on specialty meds and was like, here you go, you figure it out. And once I got that, it was like, okay, I like this challenge. It shouldn't be a challenge, but it is. So I just dove in. And so I started out licensed practical nurse. I then became a certified professional coder, which I talked to a lot of practices on billing and coding for these medications, and it's critical. It's critical to your prior auths. It's critical to any approval for you to have these. So I then became a prior auth certified specialist. And I'm also a board certified patient advocate. I think that the patient voice is the most important, right? We need to be patient centric in all of our decisions and everything that we do as a healthcare provider. So I like to have that one. I do have they're not really a day job. I have my life and my passion projects, and they all overlap. So again, I'm the CEO of MedicoCX, as well as the president and co-founder of NAMAPA. So who and what is NAMAPA, and why do we have a really long acronym that can be pronounced probably 5 different ways? But it is the National Association of Medication Access and Patient Advocacy. Trying to cover a lot of bases in one title. It's kind of hard, but we are a 501c3 organization and dedicated to helping healthcare advocates feel confident in their medication access roles. So most patients, if you have a chronic disease, you can find a disease state group, right? If you have psoriasis, if you have cancer, if you have any of the other ailments out there, you usually can find some kind of support or a group for it. But on the healthcare side of things, we don't really have these communities, or they're just starting to grow, where we can turn to for resources. So the best way we feel that we can help patients is by educating the healthcare workers who help them. So that is how this organization was started. There are several other people out there just like me, and we came together and said, let's do this. So I'm going to be saying acronyms. I'm going to be going through terms. These are all really important for you to know, especially when you're having conversations, especially financial ones, with your providers. So again, this is recorded. You can always come back later and take a listen to it. On the NAMAPA website, we do have a definition sheet going up, so you can always take a look there too. But the biggest one is out of pocket. How much money am I going to have to spend after I have my insurance? So that's what you're responsible for. Your premium is the cost it is to have the insurance. So those are 2 big factors in how much money you will spend in care. You've got deductibles. That's the amount that you would owe. You have to meet, and there's different ways that's structured. You've got copay, which is the amount you would have to pay. And that's usually a set price, right? $20 for a specialist, $50 for a specialist. Coinsurance, and an interesting statistic about coinsurance, and then in a recent survey, 77% of people did not know what coinsurance was. And it can be kind of hard to explain. So I'm not shocked by that number. But at the same time, it really puts the pressure on myself to say, hey, listen, we really need to educate what this is. So a coinsurance is a percentage of services rendered, and that can be before or after your deductible. So sometimes you'll see on your card, or you'll hear someone say 80-20, 70-30, and that's what that split is. So you may, as the patient, have to pay 20% after a deductible is met, or you're paying 80% up front. It just depends on your plan. There's network, so in network and out of network. Providers are contracted with payers, right? They sign a contract saying, I will perform services and I will get paid this much for those services. Sometimes they're in that network, sometimes they're not. And that can be a cost differentiator for a patient depending on where you go. There's also HSA, or a health savings account. This is a way to pay for medical expenses. These are pre-tax dollars that go into these accounts. So it can be a tax saving for individuals that have it. Place of service, right? Back to that in-network, out-of-network. This is another piece of how much a service will cost. Are you at a hospital? Are you at a physician's office? Is it an alternate site of care or infusion center? Different places. And on the coding side, guys, to kind of give you a little insight there, each one has a different number. So that's how we can identify where those are. More terms as we talk about medications. You've got retail pharmacy, mail order pharmacy, and specialty pharmacy, right? Your retails are your Walgreens, your CVS's, your local small community pharmacy. Mail order, just that, comes in the mail. Those are typically your 90-day scripts that you pick up or get sent to you. And then a specialty pharmacy, just like it says in the name, are special in their own way. And they usually handle medications that are typically more expensive, have special handling, cold chain, maybe they don't need to be kept cold, they have a shorter shelf life, things like that. So specialty drugs come from specialty pharmacies. And let's talk about ways to afford that and copay assistance. And there's different types of copay assistance. Typically, we lump it all together and just say, oh, copay. But there are copay cards. You probably have seen a commercial somewhere that says, oh, if your doctor writes this medication, pay $0 or pay $25. Those are typically coupons or copay cards that allow those. A patient assistance program, or PAP, as we call it, can be free medication programs. Those can also be what are called bridge programs while we're doing something like a prior authorization or working to get you coverage for your medication. And if you're ever in that position of you're waiting for something, it's a great question to ask your provider. Is there a patient assistance program, or is there a free drug program? Compassionate use, I throw this one in. Most people have never heard of this. Most people will never have to use this, but they do exist. I actually spoke with a rep over the weekend, and they were like, oh, what? We don't have that. Yeah, every manufacturer has this program under this term or a different term. But essentially it is, if you don't qualify for a clinical trial, if you don't qualify for the medication outright, there are programs that you can apply to, and your provider has to assist to get you that medication for your disease state. And then to get all this stuff started, there's what's called pre-service review. And this is where we have to ask insurance for permission. I don't like to use that term permission necessarily, but in a way it is. We have to build our case that says the patient needs this, and can we please have X, Y, and Z? So where does insurance come from? That's a whole bunch of terms we went through, which could be a whole day class on itself, but how does that apply? Where does this insurance come from? So it can come from yourself. You could purchase it. You can buy it through the marketplace. You can buy it through the United Healthcare website or whichever plan, or you can go through a broker that can help negotiate and talk to you about different available options you have. I think a lot of us have employer-based insurance, right? So you work somewhere, here's your 3 options, choose what works best for you. And a lot of times in this day and age, I see employers will cover a portion of your premium. Remember, that's how much you pay per month for your insurance, which is great. I think that's an awesome benefit to add, especially for younger workers or those starting out. The marketplace, after the Affordable Care Act was passed in 2010, this changed the underinsured versus uninsured parameters. So the marketplace is kind of your general place to go. You can shop what's available in your area. It's by location, and see what's out there. And you can utilize tax credits if you're eligible to help cover that premium. Government insurance, separate from marketplace. Government insurance is for Medicare, which would be 65 and older, or other qualified patients. Medicaid, which is your state issued insurance. So think Medicare, federal overarching, Medicaid by state, and then TRICARE, which is for our military members. One that is somewhat making a comeback, I've heard of it more lately than I had before, are the health sharing plans. And health sharing are typically faith-based, but I've seen some newer ones that are community, like let's all come together, you put money into a pot, and if you need it, pay your medical expenses. This is a different type of insurance, and it qualifies as insurance, so it's a little hard to explain, but it kind of doesn't. So health sharing, if you're in one of those plans or a part of one of those groups, certainly make sure your physician or provider is aware, because that may have a different part of you getting a medication you need. So we've covered a whole lot already. Welcome to the first webinar here, but let's dive in a little bit deeper on this. And when you go to the doctor and you need care, right, you're using your medical benefit or your major medical, is what I hear a lot of people call it. And this is your insurance lumped together. Depending on what you need, depends on whether you need a medication, maybe a procedure, maybe some kind of testing. Those usually fall under your medical benefit, unless it's a prescription, then we'll go into the pharmacy side. But asterisk, caveat, could be something different. Some medications are acquired under your medical benefit, just like going to the doctor part, because your doctor can provide that to you, or it's a specialty drug that just has to run through that medical side, but it comes from a pharmacy. So without going into too much of confusing information, a great question you can always ask, especially on the medication side, is which benefit covers me the best so that I can have this medication? And sometimes there's an option there. To quickly run through some of these bullet points, your medical benefit provider services, works with plan deductible, copay or coinsurance amounts. And on your pharmacy side, so this would be Part D for Medicare beneficiaries, and we'll get into some Medicare here in a little bit, frequently follows a kind of tiering system. So it's not necessarily, $20 here, $50 here, while it can be, depending on what tier that drug falls into. A lot of times it's a percentage or something like that. And one key takeaway on this is when you're looking at medications under your pharmacy benefit, there's a big difference in 30-day versus 90-day prescriptions. Sometimes you pay the same cost for 90 days that you would at 30 days. So that's a great question to ask before picking up any medication or having it shipped to you. This is a picture of an insurance card, and I would say my paint skills are wonderful because I made it. But it is what a typical insurance card may look like. They're all a little bit different, and some have pictures or logos, and some are just, here's your info, this is what you get. But the highlight on here is knowing your information, right? When you call to make an appointment, when you're calling to ask questions, you need to know some of these basic numbers to be able to communicate and find out what you need. So your insurance ID, that's the supreme ruler of all insurance information. Make sure that you know that ID number, followed by your group number. Those two numbers are kind of the keys to the kingdom, as well as who's the subscriber, right? Is it under your spouse? Is it under you? Is it under a parent? Those are all important things to know. And then sometimes the pharmacy information, right? The stuff that your local retail or specialty pharmacy would need to know is on the front of the card. Sometimes it's one little tiny number down at the bottom. It depends on where that is. And sometimes it may even be a whole separate card, though I don't see that as much anymore. So let's talk about Medicare, right? So that was a commercial insurance card, what you would typically see out there. Medicare is different. I think everyone has seen or heard of a red, white, and blue card. Years ago, it used to be your social security number on there. That has been gone for a couple of years. Now it is a unique identifier to that patient. If you have a Medicare Advantage plan, which we'll talk about here, which is your Part C, you may have what looks like a commercial insurance card instead of that red, white, and blue, though you're still going to get that one in the mail. So for Medicare, there are 4 main parts. You've got Part A, which covers your hospital. You've got Part B, which is just like we were talking on that commercial side, that medical coverage, right? Your providers, provider administered medications. Part C, which is your Medicare Advantage, which I like to call the squished together version because it's all of these things squished into one. And then you have Part D, which is your prescription or pharmacy benefit. This is a great chart to talk about what your Medicare choices are and how to make those decisions. This is found on Medicare.gov. You can take a look at it on the website if you're coming up on that age to look through there. So Part D, prescription drug or pharmacy benefit. These are usually run by private insurance companies. Medicare Advantage plans include this, so it's not a separate entity there. There's no pre-existing condition clause, and plans have different formularies, cost structures, and their preferred pharmacy, right? So if you use Costco or Sam's versus CVS, you should be using the Medicare.gov site, and you should be taking a look through there to see what best fits the medication you need. So every year during open enrollment, I strongly, strongly recommend, and from my wonderful medication, our Medicare teacher, Geraldine Arneson, she taught me that everything I know about Medicare and more, but every year during open enrollment, a patient should be going through that. Look at what's available to you in your area. If you have questions, reach out, but certainly take a look at that because things change, right? It's healthcare. We're known for change. On your Part C, so your Advantage, you're squished together, everything in one. These are plans offered by private insurance companies. They use doctors and hospitals in that network, combines everything together. Some have additional benefits not covered by your traditional or original Medicare, dental, hearing, vision, so on. Some wellness programs. I'm sure you've seen a commercial at some point, especially going October, November, right? It's like, get a free pair of tennis shoes, get a gym membership. Sometimes they'll offer some of those. But one thing to think about is, depending on what disease state you have or what chronic illness you have, is that the best coverage for you? So I am not certified. Medicare is not my thing to give advice on. However, I will say, if you have questions on that, there are resources available, which we'll talk about today too, but always ask, right? Can I speak to someone? There are Medicare benefit enrollment counselors. Ask them, what is the best coverage for what I currently have going on? We all love to insure our cars, right? When you buy a new car, if you take a loan, you have to have full coverage. But when it comes to our bodies and our health, we tend to want the cheapest plan possible. So when you're looking at your available options, think about yourself like a car. I know that seems silly, but you want to insure yourself the best you can and set yourself up. So especially in the Medicare population, when you're choosing a plan, make sure it's going to carry you for a long time, not a short time. Supplement plans. This was not on that lovely graphic that had A through D. This is an additional plan, Medigap or supplement. These are the LMNOPs, as I like to call them. Sometimes you'll see F, G, M, N, things like that. And they pick up or cover the portion that original Medicare does not. So to kind of break this down a little bit for you, if you have an Advantage squished together plan, that's all you have. If you have traditional Medicare, A, B, and D, this is another option to help cover what those don't pick up. All right, so how to look at costs when considering care. We've talked about all these different terms. We've talked about what different types of insurance are, how they apply, but how does all of that work when you're going to the doctor and you're trying to take care of yourself, right? We're trying to be our own advocates here. We're equipped with the knowledge to take care of ourselves, but how do we look at this? How does it all come together? Well, got to look at your deductible, right? How much money am I going to have to owe? What's going to be my share of it, right? Is it based on me? Is it based on my whole family? In my situation, it's based on my whole family. Do I have a copay, right? Is it just a flat fee or a coinsurance? So I could be paying more. Is there a maximum, right? Am I going to hit 10,000 and I'm done? Or do I got to go higher than that? And then what assistance is available to me? If I'm going to the pharmacy to pick up my drug, do I have a formulary? Am I even allowed to get the medication? Is there a certain tier? Do I need to talk about a tier reduction maybe? Is it cheaper for me to get it in the mail? And then are there copay cards available? So I have some scenarios here, and these are ways to kind of look at and frame typical things that happen in medication access, right? I'm a big fan of Talladega Nights. So Ricky Bobby makes my first scenario here. He visits his primary care and needs a pharmacy benefit medication, right? So this is going to come from either a retail, mail order, or specialty pharmacy. Looking at the patient's benefits, because we're looking at the whole picture. He has a $5,000 deductible, $8,500 for his family, $20 copay, and $50 copay for specialists, right? But again, we're picking this up from a pharmacy, or it's coming from the pharmacy side. But it's good to know still what his deductible is, because he had to go to the doctor in the first place. For the pharmacy, they work on tiers anywhere between $0 and $100. So total cost for this visit, the physician allowable is $300. He paid his $50 specialist copay. The medication prescribed, unfortunately, is a tier 5 $100 prescription for 30 days at the retail pharmacy, or same price, it's $100 at a 90-day mail order pharmacy. Then there's a copay card. Yay! $25 per dispense, 30 or 90 days. Again, this is a made-up scenario. I wish this was real for everyone. It was this simple and straightforward. But in this case, patient has a $4,700 out of pocket. He still has to reach after that appointment. And then he's going to use the copay card, the $25 copay card. And the best deal is the 90-day mail order. So $25 for 90 days worth. Lots of numbers, lots of pieces and parts to that. But at the end of the day, he's getting his medication for $25, 90 days worth. Scenario number 2, a little more complex, because the last one we used our pharmacy benefit. This one we're using our medical benefit, getting the medication from our provider. So this has a whole scenario with copay cards and the deductible as it goes down, and the copay card picking up some of that. In a perfect world, it would go this way every time. But there are different types of plans and different parts of access that can make this a little bit more difficult. So Melissa Johnson visits the specialist and needs medication provided by that doctor. They have a $10,000 individual deductible, has met a little bit of it, a 80/20 coinsurance, but they're 100% covered after that deductible is met. So that's good news, but 10,000 is still really high. Pharmacies on tiers, right? But we're going to focus on that medical one because that's where this medication will come from. They've got their physician visit allowable. Medication is prescribed, it's IV infusion, has a copay card. So first infusion, $5,000. These numbers are scary, but this is very real in terms of cost for specialty drugs. The copay card covers the patient responsibility of $4,000. The deductible is now $4,280, and the copay card balance went down. So as you'll see, by the third infusion, the copay card covers the patient responsibility left, and they're now covered 100%. So their deductible balance is now 0. There's still money left on the copay card, but the patient is not owing anything out of pocket, which is great for that patient. The timing part of this could be what time of the year. If they hit this in March or April, and that copay card goes into the next year, there could be some issues there. But that's why if you have a copay card and you're getting a medical benefit drug like this, just always ask, what's the timing? What do I need? Is this going to carry me through? Lots of questions you can ask there. So some complicating factors, right? I just said in a perfect world, this would be great. However, I'm going to go back to this as healthcare, and nothing's quite perfect. But there are plans that make this a little more difficult for our patients, such as copay accumulators. That is something that we could really spend a whole nother hour on. If the patient has what's called an off-label diagnosis, And when a medication is launched, there's an FDA approved diagnosis for that drug. If your patient does not meet that, or if you as the patient do not fall into that, there are other options out there, but it can make it a little more complicated to get that drug. There are things like step edits. Was the term that wasn't on the sheet in the beginning, but probably should be. A step edit means there are certain medications you may have to try first before you can get the one your doctor wants you to have. And there may be income limits for copay assistance, right? If you have too high of an income, if you are outside of the percentage of poverty, that can make it hard for you to get free medications if you qualify. But there are programs, right? There are help out there depending on the type of insurance you have. So for Medicare, there are things like low income subsidy or extra help is what this one's most commonly referred to. So if you have limited income and resources, it can help pay for those medications for you. There's a Medicare savings program. This is where the state helps pay for your Medicare costs if you have limited income. You have to roll through your state Medicaid office. There are medication assistance for Medicare patients. There are wonderful programs and foundations such as Accessia Health that you can refer to depending on your disease state and diagnoses. Depending on the type of coverage you have, depends on what is available to you out there as well. If you have questions, again, go to your Medicare benefits counselors, Medicare.gov, take a look at some of those things. Each state has their own as well. Some are really great, some are not as great, and some are hard to find, but each one should have a version of this. And then the highlight of today, right? How to be your own advocate. As I said when I first started, I'm not the greatest for myself, but I try very, very hard to practice what I preach. And I'm great with my kids. I took them to the pediatrician yesterday and I'm like, hey, this is going on. This is going on. I have a question about this. No problem. My own self, I'm like, well, is it okay if I ask this? May I ask a question? So sometimes I have a hard time, and that's okay, right? So there are tools, there are things you can use outside of just talking to help get those questions out. So first things first, though, you have to own your patient journey, right? I don't feel well. This is going on. I need help with this, right? That is you. It's the body you're given. Own it. Record or journal your symptoms, the effects, the quality of life that it has for you. I love to use the patient portals. My provider uses an Epic system, which is a electronic health record, and I can message through that to my physician. So the night before my appointment, if I'm afraid I'm going to clam up or I don't want to forget anything, I will use that patient portal to send my questions ahead of time, right? It's not perfect. Sometimes they don't get it. You know, there's lots of patients doing the same thing, but it's a great way when you get there the next day to say, hey, I sent in some questions. Can we go through those? So use what's at your fingertips there. Also, a lot of practices now will have like a iPad at the front desk, or sometimes you're still filling out on paper some information. Jot those questions down on that. As you're checking into the iPad, you know, when you go to turn it back in, say, hey, I have some questions. I want to make sure I have time for this. That's a great way to get started there. Never be afraid to ask them. That's the best one. I think oversharing is caring. I talk a lot, full disclosure. And when I get nervous, I talk even more. So imagine that as I'm racing through this one. But I think the more that you can share, the more information you can give, the better insight it gives to your provider. Finding the right care team is essential. Now, I'm not on the team that says, if you don't like your doctor, fire them, but certainly communicate that you're frustrated, that you need something more. And if that doctor's not the right fit for you, go for second opinions or other opinions. That's okay. We are a healthcare team. It is our job to make sure if you are not comfortable there and you are comfortable elsewhere, that we provide that information to your new provider. But always, always, always try to communicate first. Don't be a Google MD, but look up resources. So I used to have a name tag at work that said GMD because I was a Google medical doctor, because if I couldn't find an answer, I'd just Google it, right? Makes sense. But don't rely on everything you find out there. There's a lot of misinformation on the healthcare side. And a lot of it comes into the social media world. And I'm not trying to get political or anything like that. It's just there are lots of groups that pop up, and it is non-medical professionals saying, oh, try this, do this. That's not correct. So I would rely on your medical professionals to provide that information to you. But there is nothing wrong with saying, okay, my doctor said I have this. Let me look up journal articles or other peer-reviewed sources as backup to that. You can also, in the medication world, look to manufacturers, right? They have information about the medications. They usually have info about disease states. You can also go to your foundations. They have information that they can give as well. And if you struggle, or if you need more assistance, there are what are called independent advocates. And like one of my certifications I have as a board certified patient advocate, there's a whole group of people out there that this is their career. And they have worked in various roles in healthcare. They have different specialties. Some are great at billing. Some are great at family dynamics and communication. Some are great at medication access like myself, as well as a multitude of other things, right? The independent advocates are yours to work with. They are hired by you as the patient, and they can help navigate some of these complexities. I'm a big fan of if children live far from their parents, say their parents are Medicare age, this is a great option at trying to coordinate care, make sure you stay up to date as the child, and can make informed decisions. So two great examples would be the Greater National Advocates and then the National Association of Healthcare Advocacy. Another resource for our Medicare patients, and if you are of Medicare age, are Medicare benefits counselors. And I've mentioned them a couple times through this presentation, but they're free in every state. Please, please, please utilize them. That is where I've learned a plethora of my knowledge. And again, I appreciate that. They don't receive commission. They're not brokers. Their goal is to teach you what's out there. So feel free to lean into those. So, and kind of wrapping up all of this and how to be your own advocate, right? There's a very technical part of healthcare. There's rules, there's policies, there's all these things that we have to navigate. And there are things that you as the patient also have to learn, such things like insurance, what coverage you have, and how to tell your doctor what you need. So somewhere in the middle of all of those things, that's where the magic happens. That's where relationships are built. That's where listening happens. And that's where outcomes happen, right? We're all in this together. You as the patient are our primary focus. We want to make sure we achieve the best outcomes for you. So stand up for yourself, own your patient journey. And if not, we're here to help.
Elizabeth, thank you. That was amazing and so full of so much information. And please, if you have any questions, feel free to put them in the chat, put them in the Q&A. I'm going to start with a question that I have from participating and listening. And it is always confusing to people. What is the difference between a medical benefit and a pharmacy benefit? And when you talk about your total out of pocket, are they different? Are there different totals, or is it all roll up into one big number that we have to be aware of?
Typically, there are two separate things, right? So let's go with the normal because that's the easiest way to explain it. But your medical and your pharmacy benefit, think of them as two different buckets, right? So you've got cost on one side, cost on the other, and depending how each are structured depends on what you pay. But typically, yes, they are two separate things, and you can hit one deductible before the other, and that can be confusing to a patient as well.
So in one of the examples that you used, when you're doing infusions, that prescription still falls under your medical benefit, not your pharmacy benefit, right? You want to talk about that for a minute or so?
Yeah, correct. So there are provider administered medications. That's what we call them. Basically, you go to your doctor's office or you go to maybe an infusion center and you receive those medications and they go towards your medical deductible. And the reason being, they're usually a little more complex than just the generics or whatever you'd pick up at retail. And so they require a little bit more monitoring, things like that. So it has to do with the way you get those medications that goes under that medical benefit. But yes, depending on available copay assistance or programs that are out there, there may be coverage to help you pay for that because typically your medical deductible is higher than your pharmacy.
Thanks. All right, we have a question that just came in. If care is not approved by the insurer, what should a patient do?
This goes into that owning your journey, right? I, as your healthcare provider, am going to build a case to your insurance from all the notes that we have at the doctor, right? What you discussed with your provider, what other meds you may have tried, and so on. And so I'm going to go to them and ask. And if I'm denied that, sometimes I have to ask the patient to write a letter or to call. You as the patient know your story better than anybody. If it impacts your quality of life, right? I come from asthma and allergy. So if you need a medication that's going to help your asthma and you struggle getting to the mailbox every single day, your insurance company needs to know that because that's impacting your quality of life. If you can't afford your inhalers, all of those things, that is what the insurance company needs to hear. And sometimes me saying this patient's tried these 6 inhalers first isn't enough. So is it foolproof? Is that going to get you approved? Most times it does, but not always. So sometimes we have to bring you back in, have another doctor's appointment, document more of what's going on. But working as a patient with your healthcare provider to provide that insight, super, super valuable.
I'd also add on that one that that's where some of our patient advocates come in. And if you're not exactly even sure what to ask your provider, bring somebody with you. Call one of the patient advocate organizations and tell them what's happening on your journey, and they may be able to step in and help you as long as you give them the proper authorizations to speak on your behalf. That's something always good to remember.
Great point.
Yep. So talk about if you can't get prior authorization, you can't get, it just is not going to fly. You're not going to get your drugs paid for by your insurance company. Talk about cash price a little bit. Is that a slippery slope? Is that something that those of us that have insurance should even consider? What are your thoughts on that?
So there's a lot of different ways to look at this, right? And I think most relevant in the news right now, we see Mark Cuban's Cost Plus Pharmacy, right? That is a cash pay. There are coupons such as GoodRx out there, not to go name dropping, but if you cannot get it approved, if it's just not possible, I always ask for samples first, right? I always ask my provider, do you have a sample of that? But cash is a way. Now, with looking at assistance options, right? Different programs, sometimes there's what's called underinsured. So you might not be approved for it, but you still have insurance coverage. So you fall in this category where you qualify for other assistance or forms because your insurance just says no, or you could have it, but something's going on. So in those cases, there are sometimes what are called bridge programs where a manufacturer will provide free medication for a set amount of time. Maybe your insurance changes, maybe the policy changes, so you still have access. If not, there are cash pay prices, and every medical office, hospital, everything should have a financial policy on cash pay prices. Pharmacies typically don't have that set up. Cash price is cash price, but you can turn to foundations and other organizations to see if they have assistance as well.
Fabulous. Still have time for a few more questions if anybody wants to submit one. And I have one more question and then a wrap up to discuss. So let's see. One question that we already received, and then we'll go to this next one.
Okay.
Is remind us again, you can always call a patient's assistance organization to help case manage your answer your questions and do some case management on your behalf. But let's say you have some really detailed stuff. Tell us again how we can get a hold of a patient advocate in somebody's area and where to call to find those resources.
Sure. I'm gonna go back a couple slides just so it'll kind of help. So there are 2 organizations that I'm most familiar with. There are lots of others out there. So each patient advocate usually has their own website and their own company. So you can Google and search for those. Greater National Advocates, to plug for them, is basically like a repository of all these different advocates. So you can search by your location, you can search by what you need. That's a great way to find one. If you're of Medicare age, and receiving those benefits. There are Medicare benefits counselors going through senior services. So call your local senior services office. If you can't find that listed, call your Social Security office. They should be able to point you to one of these.
One of the questions that we get often is the difference between Medigap and Part C supplemental plans. And if you were not eligible for Medicare prior to 2020, can you get a Medigap plan? Or if you're on a Medigap plan because you were eligible before 2020, can you switch to a Part C Medicare Advantage plan? We get that question pretty often.
Yes. So there are different rules around when you're switching, and I don't want to misspeak on the exact timing. But yes, you can change. Typically what happens is someone starts on the Advantage plan, the Part C, and then they go, oh, no, I want to go back to traditional Medicare. And so they have to go through that. And there's a period of time that subjects you to underwriting or no underwriting. So I'd say go to your benefits counselor again and see what you're eligible for, depending on that time frame. But yes, you can change back and forth. But I made a comment early in there is that when you're signing up for Medicare, right, let's consider the whole entire of what's going to happen the next 20, 25 years.
Right.
So while it may be a little more expensive today, that may be able to carry you longer without having to change, because that change can be expensive and it can take a little bit. So to answer your question a little more directly, yes, it's possible. Just really, I would go for help on that one.
And we always tell people those commercials you see all over TV during open enrollment, listen to them. Go to the website, look it up, find out the dates, and then ask questions, ask questions, ask questions. You can always call Accessia Health to get those questions answered.
Absolutely. And a lot of times we have patients come in and that's the first thing is, I'm about to get Medicare. What should I do? And I think it's great that you're asking your healthcare provider. Way to be your own advocate. I'm proud. You may not get a direct answer. We tend to dance around that because we don't want to give you the wrong advice. So definitely rely on your resources there.
So let's swing back to employer-sponsored healthcare and some of the things that are happening in the employer space. So 54% of all Americans have insurance through their employer. Huge percentage of those have a high deductible plan, lots of copays, co-insurance, all kinds of money that we have to spend in order to get the healthcare that we need. So being your own advocate is extremely important. The question that came in was talk about specialty carve-outs. I'm going to say that is a loaded topic. And if you want to give that high level, this is what it is, we are going to do an Amplify Your Voice, Control Your Care webinar about specialty carve-outs, because as soon as Elizabeth and I think we know what we're talking about, it changes. Or there's another plan that employers learn about, ways that they think that they can contain costs. We like to say we want to help employers control costs by telling them the patient, what happens to the patient voice, having that patient's voice front and center to say, this is what's really happening when you're doing this. But Elizabeth, why don't you give us the short definition of what a specialty carve-out is?
Yeah, sure.
Right.
So I've been burned with this before. And one of the things that I do in my career is I help physicians provide physician dispensed medication, right? That is my main wheelhouse. However, some employer plans do not allow medications under the medical benefit. It all has to be through a pharmacy that they're either partnered with, they may own. There's a lot of different things that go into that. And so when I'm looking at an insurance card, one of the first things I look for is an employer logo. That's my first indication that it may be something different. And it's not just your traditional, it'll follow this path. So then I know that if I'm having access difficulties, I'm going back to that employer to ask questions in their HR department. So what a carve out is, or a specialty carve out, is where they say, we have a set of rules for how you're going to get this and where you're going to get it from. So it may not be, the pharmacy you've always used. It may not be in your physician's office. It may be one set place, and that's your only choice. And for better or worse, I think that's limiting to patients, especially when it comes to what benefit you get it on, and if that's meeting a deductible or anything like that. But yeah, in a nutshell, it is, you have to follow those rules. This is where you get it from. No ifs, ands, or buts.
I see a webinar, I see an FAQ, I see a slideshow in our future about this because it is very complicated and we all need to be our own advocate when it comes to our prescription medications. So the last question that we have is really gets to the heart of being your own advocate. What do I do if my physician won't listen to me? What do I do if my physician sees me for the 7 minutes that he or she is allotted and then they walk out and I have a million questions? And I know I can answer this, you can answer this, we can all answer this. Give us 3 tips for a patient to truly be their own advocate and feel like they're being heard.
Yeah, and it's hard, right? These tips are hard because it requires you to dig down deep. But my first one is stand your ground, right? You have questions, you need more, vocalize that. And one of the things I said earlier is send those questions through a portal the day before your appointment. It's a great way to have those in so you can address those. But if you are not getting the time that you need, if they won't address it at that point, you can make another appointment. I usually, when I'm calling to schedule, will say, hey, I've got a lot I need to talk about. Can I have a 30-minute appointment or an hour appointment? Doctors can accommodate those schedules. And if not, I hate to say this, but they may not be the provider for you. And so that's where I think a second opinion is really important. A second tip that I would have is your journal, right? Write down how you are feeling, what's going on. I'm an allergy, so food allergy, we're big on diaries. What you eat in a day, just jot it down. And I know that can be a lot to put on a patient. And then third is that ask questions of those in your area, right? If you're of the Medicare age, I'm sure that there's somebody somewhere that is seeing a doctor for something similar or with that same type of insurance. Regionally, that's a great way. Just ask questions. Health grades is kind of like a Yelp for doctors. You can certainly refer to those. Those are a great way to kind of find your local physicians.
And I'm going to add 2 more. One is that hospitals, providers, they're all on the hook for the outcomes of your care. So it's important to them. Sometimes they may forget because they have to see so many patients in a day. So sometimes a gentle reminder that I want to help you do your job better so I can have a better quality of life. Will you please take 5 minutes? Go a long way to somebody going, whoa, wait a second. I do want to hear what you have to say. Might sound a little harsh, probably a softer way to say it, but I have found that if you're knowledgeable about the healthcare system and the payment structures at all, like what we've learned today, that it gives you some more credibility with a physician that you're not just there for them to talk at you, you're there to talk with them as well. And then the other tip that I would give is that because a lot of providers are owned now by our hospital systems, there are always social workers available. Their job is to help you. So if you're not sure even what your doctor is saying to you, you're keeping a journal and you're not sure what to even show to the doctor, call the provider's office and or the hospital system and say, hey, can I talk to a social worker? I have some questions. And they would love to help you. Very often they're serving as advocates for patients that don't even know they have an advocate. And so it's a great place for you to start if all the other tips that Elizabeth has given you aren't working. So with
Great.
that, thank you for being here on our very first webinar, Amplify Your Voice, Control Your Care. And Accessia Health is here to help you. We are a patient's assistance program, and we're available to answer any questions at any time. Just give us a call, visit our website at accessiahealth.org, and together we will help you amplify your voice and control your care. Thanks.